As part of our ongoing ESCP campaign, spotlighting leaders of our affiliate societies leading to Paris Tripartite 2025, I have the pleasure to introduce today the new president of the American Society of Colon and Rectal Surgeons, Dr. Mahmoud. Dr. Mahmoud is a full professor of surgery at Penn and current chief of the Division of the Colon and Rectal Surgery at Penn Medicine. Thank you so much for taking the time to be with us today, Dr. Mahmoud.
Thank you so much for having me. It's really my pleasure and honor to be here.
And just for an introduction for those who may not be familiar, can you briefly introduce the American Society of Colon and Rectal Surgeons, as we call it here, ASCRS, and its core mission?
Oh, sure. So the American Society of Colon and Rectal Surgeons is a society that's about 125 years old, actually. And the mission has evolved and changed. Our mission statement actually says that, we're basically a community of healthcare professionals. So we're inclusive of both colorectal surgeons as well as our partners who are advanced practice providers and ostomy professionals who are dedicated to advancing patient care for diverse populations through the understanding, prevention, and treatment of disorders of the colon, rectum, and anus. So that's our mission statement. And basically, what we do is we have a set of core values that involves promoting the lifelong education and training of colorectal surgeons. So we really support the education, we support career development, we support the professionalism of our members, stewardship of the profession, and obviously high quality patient care. Research and investigatory collaboration is a real part of our mission and part of what we do as well through the Research Foundation. So those are the basic things that ASCRS does, and we've been around for a long, long period of time.
That more or less covers my next question as well, because I was wondering what is currently focusing on how supports its members and enhance patient care, but this has already been answered. So, what is your vision for ASCRS under your leadership, and what goals do you hope to achieve during your presidency?
Well, I've been really lucky because I've had leadership presidents like Dr. Sonia Ramamurthy, and Dr. Matthew Much, who have really shepherded and stewarded the society through some interesting and difficult times beautifully. And so picking up where they left off is really what I'd love to do. My unique vision is to enhance the understanding and integration of evidence-based approaches to colon and rectal surgery. So sort of emphasize the science behind what we do. The slogan, if you will, of the 2026 ASCRS meeting in Tampa, Florida, in May of 2026 is evidence-based excellence. And it just sort of encapsulates my vision as of this year being a year where data-driven science and evidence predominates the discussion around colon and rectal surgery, the research behind what we do, and the clinical applications of that research that really drive our mission forward.
This is an amazing vision, and guidelines is indeed my passion as well. Now moving forward, ASCRS has strong partnerships with international colorectal societies, including the European Society of Coloproctology. How do you see the importance of these collaborations in advancing our field?
Oh my goodness! So I think under Dr. Ramamurthy and prior presidents as well, ASCRS has always been a very outwardly looking international society. Many of our members, we have international members. We have many members of our American Society of Colorectal Surgeons who are not from the United States. So we've our journal diseases of the colon and rectum, led by Dr. Susan Galandiak, has always been, and increasingly so under her leadership, been a journal that has incorporated the vision and has been of others outside the United States and she's really expanded that vision. It's really been amazing. So I feel like ASCRS, although it's American Society of Colorectal Surgeons, has always been a society that has sort of served the world, much like the European Society of Coloproctology. I think that both of our societies are very outward-looking, very inclusive, and very interested in incorporating viewpoints from outside our own countries. Certainly, we have collaborated in the past on, for example, clinical practice guidelines. There were some key clinical practice guidelines, I can recall a few years ago that were published jointly by ESCP and ASCRS. And I thought that was a perfect example of how we can, create a joint create joint statements that serve both our patient populations. But we have a lot to learn from each other. And I am so excited about the upcoming ESCP meeting because I think that the more cross-pollination that we can do between ASCRS and ESCP, the better both of our societies will be. I think we have a lot to learn from each other. I think that the differences between how we practice are not so great, but there are key things that we can take away from each other that we can use and learn from. So just, having that diversity of vision and evidence, things may work really well in one country that don't work so well in another country. Understanding that is, I think, going to be a key part of our collaboration or collaborative efforts. So I'm really looking forward to being at ESCP and just getting to know ESCP a little bit better.
I completely agree with you. I think collaboration is the way to move forward. And I feel that academic surgeons are and should be citizens of the world. We should speak the same language in order to advance the field. And now to a subject that is very dear to me, about supporting young surgeons. How does ASCRS support young surgeons and encourage participation in research and education?
Great. So, our Young Surgeons Committee is like our jewel in the crown. So we agree that young surgeons are our future. They're our future. That's, who is going to be taking care of the world and taking care of us. And so making sure that they have great opportunities for leadership, for career development, through career growth and research opportunities is what we're all about. Our young surgeons, the chair of the Young Surgeons Committee actually sits on our executive council. So that's how important we feel having a young surgeon having a voice at the table is. So they sit among all the other leaders and are constantly there to remind us what the vision from the young it really is. We have a really great, robust surgical leadership institute that was started by Sonia Ramamurthy several years ago. And we've been doing that as a standalone meeting for a few years. And I think predominantly the people who come are young surgeons. However, we've sort of deconstructed that meeting a little bit. And under Glenn Alt, we are uh, sort of sprinkling some of that career development leadership training among some of the other offerings that we have. For example, we have a great course that Dr. Emily Steinhagen and Michael Valente in Cleveland have shepherded along for years, called it's we call it the Cleveland course, but really it's for the fellows to come and meet each other, hear talks from ASCRS leadership about all aspects of career development, uh, and how to get involved with the society, for example. And that's been going on for years, and it's great. And recently, we've sort of merged it into ASCRS and have further supported it by um, embedding some aspects of our Surgical Leadership Institute into the career development course. So it's going to be amazing. And it's for young surgeons, it's for our fellows, our future colleagues. And I think it's going to just be, sort of like jumpstart their career, jumpstart their professional development and their career development. And so we've decided to invest a lot of resources into that, and I think appropriately so. Um, uh, but yeah, so I think of young surgeons as being embedded in both the executive council as well as everything that we do. Every discussion that we have at the executive committee, we almost always reference the young surgeons because we understand that they are, um, they are our audience, and we really need to grow them. And in fact, I have to say, Zoe, that, over the last few years, we've seen a real uptake, or we've seen a real growth in the number of candidates and members that have joined ASCRS. It's been incredible. If I look back over 20 years, our society has doubled in size. Yeah. And in the last 5 years, it's really sort of exploded, especially at the younger level. And some of it is some of it's because of ASCRS U. If you want ASCRS U, you can join for $25, and suddenly you're you're a candidate member. So the price point is small and the benefits are large. So
These are all our amazing opportunities, indeed, and I guess the number speaks for themselves. And ESCP, it's the same. The young surgeons indeed sit in the executive committee, and they have the same support. Um, Excellent. And of course, Dr. Mahmoud, you'll be participating in Tripartite that we all look forward to. Can you share some insights about the topics that you will be covering and things that you are most excited about this meeting?
sure, absolutely. Well, I'm really excited about the meeting for all the reasons that we discussed. I'll be talking about a subject that is very near and dear to my heart, surgeon resilience and moral injury, surgeon well-being. We hear a lot about that, but some of the causes of moral injury, some of the things that we deal with now and in the future are really career defining, and sometimes not in a good way. And understanding what the underpinnings of some of those problems are and how to be involved in being the solution and not the victim is something that I'm going to speak to at the ESCP. And I think that there are insights that I have that are applicable to not just American surgeons in our American system, but sort of globally. Surgeons in all sorts of healthcare systems throughout the world are dealing and struggling with similar problems. It's not just here. It's not just in Great Britain. It's not just, it's everywhere. So I'm going to talk about some of those things and about some of the things that we can do, discrete things that we can do to make a difference and help ourselves, help our patients, and help each other.
I'm very much looking forward to it. It's really important because you're a trailblazer, and a leader of your status, deconstructing the surgical archetype. It's really moving the things forward. Now, in this vicinity of issues, what do you see as the most pressing issues facing colorectal surgeons today, and how is ASCRS addressing them?
Mm. So I think that right now, there's a variety of issues that are facing us, at least here in the United States. For I think uh, uh, struggling with new models of compensation and patient insurance. Third party payers, struggling with the demands of being hospital employed versus academics versus private practice. When you look at our uh, the entire cohort of colorectal surgeons, we used to be private practice, right? You used to be our own bosses and make the rules for ourselves. But as time has moved on, many more of us are hospital employed or employed by large health systems. So the change in the way healthcare is delivered in the United States through large health systems employing physicians, and even academic health systems, as you may know, are not sort of don't look exactly like the academic health systems that we used to have back in the good old days, right? Where money was no object and RDUs were just we didn't even have them, right? So now we have to deal with these new business models. And I think that trying to find your way either as a straight clinician, dealing with patient volume, trying to count RVUs, trying to meet targets, trying to negotiate those things is incredibly stressful when you're trying to also balance starting a family, buying a home, which is incredibly exorbitantly expensive these days. So, trying to find your way in the world in a changing atmosphere, in a changing milieu of compensation and business is really something that I think is hard to navigate. And I think that that's probably the biggest challenge that young surgeons and older surgeons, by the way, have these days. I think that we're all struggling with how to do this and make it work for ourselves and for our patients. So it's been a real adventure, and I've seen a lot of changes over the last 20 years. Some of them great, right? With the advancement of technology and the discovery of things like immunotherapy, for example, and advanced surgical techniques like robotics and laparoscopy. I've lived through all of that. But I've also lived through changes in physician compensation and the business model that has not been as favorable to physicians and to people who work in healthcare. And I think that navigating that and finding our seat at the table is something that we need to do, but we need help doing it. I think that just to reference our prior conversation about young surgeons, when I was talking about the Cleveland course and trying to embed part of our Surgical Leadership Institute into that course, the purpose of it is to support our young surgeons through navigating these changes in our healthcare system that directly affect their ability to do their jobs. And I think that is our greatest challenge. And ASCRS is rising to that challenge by trying to create specific content to help with that. We do it through the Cleveland course. We do it in an ongoing rolling basis through the video webinar series and our video mentorship series. All of that can be seen on ASCRS U. If you're a member, you can click and log on, and you don't even have to be there. You can go backwards and you can look at that stuff, anything that's interesting to you. And we do it through things like the compensation survey. We put out a compensation survey a few months ago to try to gather data from our members regarding issues around the business model of healthcare and their own personal interaction with it that were important to them, just so we can understand where we are in this point in time so we can sort of structure how we structure our offerings or how we go forward in the future. So, the ongoing accumulation of knowledge about our members and the concerns of our membership is something that means a lot.
I think you hit the nail in the head. You highlighting the flaming issues and how ASCRS really helps solving this. And any final thoughts or messages for our global colorectal community before Tripartite 2025?
Well, I think that my final message will be sort of what the theme of my meeting is going to be: evidence-based excellence. I think that we should all continue to strive for participation in clinical trials, advancing knowledge through our own research, as well as collaborating with others who are doing research, adhering to our clinical practice guidelines, reading about them, participating in them, and really incorporating them into our practices. So I think, the more we lead with science, I think the better off we are, and the better off our patients will be. So that's my message, and I think it's a good one. I think it'll resonate with a lot of people out there right now.
Indeed, here's to your message. And thank you sincerely for your time and for your insight. It truly has been a privilege.
It's been so lovely to speak with you. I look forward to seeing you at ASCRS and DSCP. Thank you.
Thank you.